Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by High-Tech Answers and HealthcareNOW Radio, part of the Answers Media Network, and is sponsored by the law offices of Myrick O'Connell. Now here is your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Remi Richard, co-founder and head of growth at Cofounder Health. Welcome, Remi.
Hello. Nice to be here.
Yeah, it's great to have you on. And kind of before we dive into our main topics of discussion today, would you be able to give everyone a little bit of a background in terms of who you are and what you do?
Yeah, for sure. Like you said, I'm at the growth at Chronometriq. Now we call it Cofounder. We're in the process of rebranding right now. So we're actually a Canadian company based in Montreal. We started in 2012, and what we built was a way for people to not wait in waiting rooms. Since then, we've pivoted, and now we do more B2B products. So we do a full access to care suite, and now we're bringing our tools, which is the tools that the most Canadian use to access to care in Canada, to the United States market. Yeah.
So have you always been involved in healthcare, or is this a new change in kind of your career path and focus?
Yeah. So my partner, Jan, and me, we started this company when we were 22 and 23. So right after university. So he studied actually in politics, and I studied in psychology. And then we had this idea of helping people not waiting room, because as you may know, healthcare is free in Canada. So that's nice, but you get to wait a lot of time to actually see a doctor. So we found a way to make it much more fun, or not fun, but much more enjoyable to just wait at home. And yeah.
Yeah, no, I suspect. Yeah, no, I suspect that a lot of people would appreciate not having to spend extra time in a waiting room.
Yeah, absolutely. It's for a $3 fee. It's less than a donut and a coffee. So it's a lot of our customers are extremely happy about that. They save an average of 4 hours for $3. It's a really great investment.
Yeah. So, kind of what led you to kind of, as you said, you were initially focused on helping to address the waiting time. So kind of what led you into wanting to address that particular issue within the industry?
Yeah. So, in Canada, it's a very big problem. The wait times are extremely long. And, my father, who's a financial analyst, one day he went to the clinic and he had to wait for 7 hours. And then, I had a small website company with my partner, and then he called me and he said, why, and this was back in 2011, and he asked me, why do I have to still wait 7 hours at the clinic? Why can't I just give $20 to the secretary and she can call me when it's my time to see a doctor? And I said, well, that would be really smart, and the admin staff would really love that because they would be rich. But the downside is, these people are so busy with answering all the calls, and their tasks, they cannot do that. So what we sent out to do is basically automate that process. And this is how we got into healthcare and just-in-time healthcare.
So kind of what were some of the challenges that you found? Because, I can just maybe not with complete accuracy, but with, some feeling of anecdotal backup, think that some of the issues might relate to, unexpected length of a prior patient visit, or really any other number of factors. So kind of, to circle back around to the question, what were some of the challenges that you identified, and how did you go about addressing them as you were looking into the issue?
Yeah. So for us, the biggest challenge was actually getting into a clinic. And getting the first clinic that would want to use our system, because in Canada the healthcare system is public, right? So even with or without our system, the clinic is used at 100% capacity. So we don't really change that. What we do is we provide a really much better experience for the patient. But and I think that in the United States, and from what we've found out so far, is that patient engagement and patient experience in the United States, it's like, I would say maybe not the most important, but maybe it is one of the most important metrics that hospital and health system look at. But in Canada, it's not something that we really look at. So we basically built a product that the people wanted and people wanted to pay for. But then we went to the clinics, and they didn't see your patient waiting 7 hours as a problem. They saw that as just a regular occurrence of being Canadian.
Yeah, that sounds like a fairly significant shift from what expectations might be here in the United States, which is I don't think anyone would wait around 7 hours for a visit. Maybe in the emergency department you end up having long waits that could be that long, but even when that happens, it seems like it's a bit of an outlier and one that would certainly drive a lot of patient angst. Yeah,
absolutely. So what we've found out is that you guys are typically American. Like I don't think any country is patient, but I think Americans are even less patient maybe than the other countries. So even a wait time of 15 minutes or 30 minutes, you guys seem to have a hard time with that. And we understand that because the way the system is built, you guys pay for a service, and it's a very, very premium service. So you expect some kind of quality, and you expect some kind of quickness or efficiency. So when this doesn't happen, then it creates friction, and the competition is so huge in the United States that then you can lose patients, and we know that healthcare system don't want that. So even if there's not a 7-hour wait time, thank God, there's still a 15-minute or a 30-minute wait time, and we wanna make wait times dynamic. So we want to be able to tell you when exactly to go to the doctor, and not wait there 15, 30, or 45 minutes.
Yeah, so kind of how do you go about passing on that message? And then, kind of as you're saying, the part of the goal is that people don't have to be sitting in the waiting room. Is it that there ends up being some type of advanced notification, or could there end up being an unintentional delay on the patient then being able to get into the exam room or otherwise end up being seen by the clinician?
Mm-hmm. So we developed a set of algorithm. Montreal is really strong in artificial intelligence. So what we do is we connect with the EMR, and we go and look at the physician's data. So we take a lot of data from this particular physician, and then we put it in the algorithm. And now after that we know approximately, okay, so this person is going to be around 7 minutes late, based on the data that we have. And then we can do some predictive, we send out an SMS with some predictive, with the correct time or the expected time when the patient will see the doctor to that particular patient.
As I said, I think it sounds very interesting, and it's, definitely kind of as you're saying, you have the big wait time issue in the Canadian system, and as we were just saying, not to the same degree down in the United States, but it's still, it sounds like it's all going towards efficiencies and trying to make the best utilization of everyone's time.
Yeah, absolutely. And the just-in-time care part of our software is just 1/3 of it. We actually built a complete app, with which you can check in, you can book your appointment. Of course, you know when your appointment will actually be, but there's also a new portion of the app that where you can find your billing, where you can answer forms, pre-consultation forms, so that when you're face to face with a doctor, you save more time. And the last part of the app also is new healthcare channels. So we're partnering with a lot of the best healthcare providers and software companies in the US, and we're going to put all these apps at the same place in your phone.
Yeah, actually, I'm very interested by the assistance that you're providing in terms of online scheduling, or the kind of the patient-controlled scheduling, since that seems to be another area of frequent complaint. So, kind of, not purposefully repeating a question, but what are some of the challenges you've had in terms of overcoming what are the oftentimes frequently stated issues with scheduling, such as, maybe the clinicians want to have control over the schedule to make sure that, appointments aren't booked too closely together, or to just, have some type of flow in terms of the anticipated issues that could be coming up.
Yeah, absolutely. So what we usually do is we provide a way for doctors and administrative staff to see the exact ROI of the tools that we provide. And oftentimes, like you mentioned, doctors, they want to be in control of their schedule. But sometimes if you got to pay 2, 3, 4 more secretaries or administrative staff, then it gets a lot expensive. And we estimate that with our products, if you use the full suite, the health system or the clinic will save about 30% of administrative staff and costs. So for sure, it's like a give and take, So it's you have to give access to your schedule as a doctor, but then you get to have like a more efficient place to work.
Yeah, no, it's like everything in life. There's always a give and take, and the need to find, an ever shifting focal point for that balance.
Yeah, absolutely.
So, we've touched on it a little bit, but obviously, as you said, you're a Canadian company that has focused on the Canadian healthcare system and moving into the U.S. system. So, aside from some of the issues that we've talked about already, which are, the fact that yours is a fully public system and ours is a mixture of it, what are some of the biggest differences that you're encountering or trying to address between the two different systems?
So you have, that's a very good question, by the way. There's a lot of time I talk with my partner, and we talk about the difference between the two systems. And for us, it's I don't want to put it this way. I'm an optimist, but it's kind of two broken systems, but they're broken differently. The American system is so expensive. I think you guys pay, 17% of the GDP of the US GDP goes for healthcare. I think in Canada it's 11%. So, but I think that the quality of care, or the quality of the experience of care that you get in the United States, it's much better than in Canada, as compared to the awesome fact that it's free in Canada. So you can get like open heart surgery and you don't get to pay anything. So that's amazing. But for your question, I think what we bring to the United States system and what we felt by coming here and talking to people is that even people who work in healthcare, sometimes they don't know where to go to see a doctor. There's some people like ZocDoc or Slingshot and other companies that bring kind of a Expedia health experience to healthcare, but even then, it's still complicated with your type of premium, your type of insurance to get the right care at the right moment, at the right price. So we're trying to demystify all of that and put all of this in an app, which a user can find all the relevant info and get access to care, get their health data, and even see a provider in the app right there and then. So we try to streamline all these processes.
Yeah, no, that definitely sounds very ambitious. And for those of you just joining, I'm talking with Remi Richard from Cofounder Health, and we've been talking about some of the issues around time management and scheduling in healthcare, and now just starting to actually move into some of the distinctions between the U.S. and Canada. But to kind of pick up on some of what you were just saying, Remi, about putting information into the hands of individuals and kind of enabling or maybe providing more empowerment. that seems to kind of align with a lot of the discussion around, what called patient engagement or patient activation or consumerism that's coming up in the U.S. So are you trying to tap into those kind of particular issues, and are you seeing those up in Canada, or is this something that is becoming more of a focal point as you're coming down into the U.S.?
Yeah, so we already do patient engagement and patient empowerment in Canada. For example, we work with Walmart. So there's 75 retail clinics in Canada that are owned by Walmart. And for sure, we see a potential for us to replicate that type of system in the U.S. With companies such as CVS or Walgreens or again Walmart. So what we would like to do is engage with the patients while they're waiting to see a doctor at, like, for example, Minute Clinic or the Little Clinic. And we think that's a huge opportunity for us and for the patient and for the company to engage and create a better relationship than just a client-provider type of relationship. So for sure, there's an opportunity there. Yeah.
Yeah, and when you're talking kind of engagement and creating a better experience, what are some of the ways that you envision that happening?
So people don't want to wait, so they can just download our app, and then they can go to let's say, a Minute Clinic, and they can book from home. And while they wait, they can go on the app, and we'll tell them activities, we'll give them health related tips, health related things that they can do to have better health themselves. And once they arrive at the pharmacy, we can tell them where, like, which so and so products are in, there's a sale right now for that product. And yeah, it's more like a convenient conversation.
Yeah, no, it kind of definitely sounds, like some of the concepts you see in more, non-healthcare type experiences where you're wrapping together a lot of different offers or a lot of different spheres of information and really putting it in a readily accessible manner.
Yeah, absolutely. And the patient, they're waiting, so they're looking for things to do. Like in Canada, we're in discussion with a couple of groups, and what they do is when you want to know if you have maybe eye problem or ear problem, so we can do tests right there on the app, so we can detect and diagnose problems and book an appointment for you at let's say an ENT. And you can get an appointment right there. So so that's the type of things that we can put in the app that enhance the health of the patients.
Yeah, and actually, kind of thinking as you're talking about that expanding scope of opportunities that might be available, in terms of, I guess, maybe regulatory or government oversight of actions, do you see differences between what's, the path that you might be able to pursue in Canada as opposed to the path that might be available in the United States?
I think you guys have, I think that the government has a much stronger oversight on the U.S. Healthcare system, but at the same time, it's more liberal. It's more free market. It's more of a free market than Canada, where healthcare is free. So Canadians expect everything to be free as well, and the government enforces that. As compared to the US, where there are some set of rules that you have to follow, such as HIPAA and so on. But if you're and FDA, but if you're compliant, then you're compliant and you're good to go, and the government will leave you do your business. In Canada, for example, the Canadian government decided to, in Quebec, the Quebec government decided to compete with one of our products. And we had already built the solution, but it's something that happens in Canada. You're never safe from the government.
That's actually very interesting. So it kind of leads me to a different but kind of more nuanced question, which is, do you find it easier to innovate in the U.S. or the Canadian market?
That's a good question. I think for a lot of reasons, Montreal, for example, is an extremely great place to develop software, especially like in the medical field. There's a lot of good universities. Obviously, you guys are doing good with that too, as being in Boston. But there's, I think, less of competition to get access to talent, and the government pushes Canadian innovation a lot. So, for example, we have a program. It's called we call it Shred Credit, and it's basically a way to get at most 80% of your software employee salary back at the end of the year. So, and this is only one advantage. So, when you add them all up, it's a pretty great place to create software. And my experience with the U.S. Government and U.S. Environment to create and to innovate right now is too short, so I cannot talk about that.
Yeah, no, that's I think fair enough to not having the full experience yet, but it kind of, but thinking about all the availability of talent and then also just the support that you're describing, and I don't know if maybe you're saying that it's kind of, it sounded like definitely some of it is unique to Montreal, but I guess more in terms of that potential funding. I don't know if you're saying that was unique to Montreal and Quebec province, or if that is something that's available across the board. But that definitely sounds like a pretty strong strategic advantage.
Yeah, absolutely. So, for example, the way we're going to organize the companies is we're going to keep all the product and all the engineering part of the company is going to stay in Montreal for these reasons. But right now we're raising a Series B, and we cannot really raise that money in Canada. That type of money that you guys have more readily available. It would be maybe possible for us to raise 50 million round in Canada, but the terms wouldn't be good, and there's less competition in the capital industry as well. So to have the product being built in Montreal, but to generate sales and products for the American market and receive funding from Americans, I think it's the best combination for us.
Yeah, no, that is very interesting. And it's, as we're already, believe it or not, starting to get towards the end of our time, I want to try and have you pull out your crystal ball. And, given that you were very much, it seems like, on the leading edge of trying to identify some issues within the industry, what do you see as some of the areas that are most ripe for continued disruption or innovation in the next couple of years?
So I think you mentioned a couple of them, but the consumerization of healthcare, definitely. So the way, and I for sure I know that Chronometriq, Symmetric Health, we're pushing for this, but we really want to put the patient in the center. And I know it's been said a lot in the past, and we want to put patient in the center, but we really mean it. We think the future is the patient. And this is why we focus all our energies and resources towards creating amazing patient experience for the patient. I think that's the future. Yeah.
Yeah, no, I think that is a very fair and valid point on pretty much all accounts, which, as you said, it's been something that's been discussed, I think with a high amount of frequency, as especially in the past couple of years. But it does feel like you're actually starting to have a transition where it's starting to become more of a reality.
Yeah, absolutely. When you there's new companies. When you look at the I would say kind of trailblazers such as ZocDoc, you see that this is a field that will be extremely disrupted, I think, in the near future. And I for sure hope that's going to be we're going to be a player in that.
Yeah, well, I will look forward to it, and I'll look forward to hearing more of your ideas. But kind of, as I'd warned, believe it or not, we are out of time. I want to thank my guest, Remi Richard, for a great conversation today.
Yeah, thanks, Matthew. It's a pleasure, and thanks for having me.
Yeah, no, it was great. And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.